Welcome back to Cheddar's News Wrap, everybody. As the Delta COVID variant keeps many experts on alert, Moderna is saying its vaccine should work against it. This comes as some regions rethink their mask and travel policies. Friend of the show and friend of mine, Dr. Daniel Fagbuyi, Obama administration public health and biodefense appointee and emergency physician. Dr. Dan, welcome back to the show. What's your reaction to Moderna's statement?
Well, thanks for having me back. Yeah, the statement is pretty much on point. They've made a difference. The mRNA vaccines have won the race hands down. So I agree with the statement. It'll probably work. We believe it is. You can extrapolate data from what Pfizer's vaccine has done. So they're in the same kind of category. So we anticipate that will be the same case. So it's nothing to freak out about.
Should vaccinated Americans, whether it's Moderna or otherwise, be concerned about the Delta variant? Or I guess the better question is, how concerned should we be about the Delta variant?
So look, great question. People ask me this all the time. Go have fun, live your life. It is the summer. We didn't have a life last year. Have a life this time, okay? Go out, have fun. One caveat, make sure you wear your mask, especially if you weren't vaccinated. The people who really should be worried, if you want to really freak out, the people who should freak out are people who are not vaccinated. Real talk, okay? The people who should be fine and should feel comfortable are the ones who are vaccinated. However, it's just kind of common sense thing. If you're in a crowd where you don't know other people's status around you, then maybe you should mask up. I never got rid of my mask. I don't know where everybody got the memo to get rid of the mask. It was kind of something you should keep in your back pocket. And if you're in a high risk environment, even if you were vaccinated, you would use that. And even in public transport and other outlets, you still have to wear a mask. So that's just my thoughts on it.
I was going to ask you that because the World Health Organization is urging that even fully vaccinated people wear their masks, but many cities have kind of relaxed their mandates or scrapped them entirely. But do you think everyone should continue wearing a mask even if you're vaccinated, doctor?
Under certain circumstances, we understand that if you got the vaccines, we know that they do work. You can have breakthrough infections. We don't really care about that if you're coming to the emergency department or ICU is when we really worry about that. So for you to have a sniffle here or there, we have colds all the time. Let's be real and be practical. We can't have people all cooped up all the time because I really worry about the fall and winter. That's what you should be worried about. But right now, go enjoy, live your life, wear a mask when you don't know other people's status. If you're in a public area where there's a large crowd, that's a really simple message. Those who aren't vaccinated, consider getting the vaccine. Very important because that Delta variant for those who are vaccinated, that's the easy button. That's easy. But for those who don't have the vaccine, go ahead and freak out right now and start freaking out and get your vaccine.
We've seen Australia and other countries in Asia tightening lockdowns again. Could we possibly see that again here in the United States, Dr. Dan?
Oh, very good question. Sounds like a story which I wrote about America not having the willpower. Look, America doesn't have the appetite for that. So I don't think we'll see that. We may see some stringent guidelines, but it also depends on the leadership and them understanding the gravity of the situation. So for the southern states and the areas where there's low vaccination, yes, you could potentially experience that, especially if this Delta variant goes rampant. 1 out of 5, almost 20% of the people in the U.S. that are getting infected right now have the Delta variant. And then there's the Delta Plus, and there'll be probably Delta Executive, high level, mezzanine level. I don't know. I'm just making them all up. But the point is there are more variants that are coming, and be careful.
Dr. Dan, you introduced me to Clubhouse. I spend a lot of times in your room. You have a huge following on Clubhouse, and there's so many questions from a lot of people in those panels or in those rooms. What have you been seeing on the ground, whether it's emergency rooms or just at your practice?
Sure. So great question. People are coming in for allergies and other things, and some may have some concerns about COVID, and a good number of them have been negative. At least that's on the East Coast side, DC, Maryland, Virginia, and PA area in which I tend to stay. But for some others in other states, they're seeing surge in cases. Look, over the U.S., we had like the lowest test positivity rate, approaching 1.9%, and I think last Wednesday was maybe 1.8%. So this is all good news. It's nothing for us to really worry about at this time, but for those states who haven't really stepped up, who have not amassed this vaccination campaign, and people aren't getting it in their arms, that's really where I'm concerned about. So they will be seeing the surge in patients. But also, we are connected, right? We're only as good as or as strong as our weakest link. So bordering states that may have access to other states can cross around, and if you don't know their status, you can get infected. So those are the inherent risks about that.
Dr. Dan, I have about 30 seconds with you. I do want to ask you one last
Yeah,
question. You mentioned that you are
sure.
worried about the winter. When it comes to variants, what is your message to Americans moving forward?
Look, there are variants and variants and variants. I spoke tongue in cheek that I'm concerned about the Delta plus plus or whatever variant. I'm just saying that there'll be multiple variants. The risk, in fact, the important part is that the disease and the infection that is causing and the transmissibility is high, approaching 60%. That's important. So people really need to look at that in terms of outcomes and how it may affect them. We need to worry about our children too, because they might not even have the vaccine available. So we need to make sure we keep this infection at bay, because the children, when they go back to school, those who don't qualify, the less than 12, until we can get vaccine in their arms, they are at risk too. So we really need to start factoring that. So wear your mask and get vaccinated.
Great advice. Always a pleasure having you, sir. Dr. Daniel Fagbuyi, Obama administration public health and biodefense appointee and emergency physician.